Hello everyone, I'm back from the video lecture and today we're going to discuss the hand cupping and flattening the arch of the hand at the carpal, metacarpal and intermetacarpal joint. Okay, simple is that the cupping and flattening of arch is performed in a way that you can just stretch the arm in a sideways. Okay, I can tell you how you can b- instead of discussing the hand placement and procedure, we can just go and discuss from this in a picture. Okay. So in this picture, as you can see, this is the patient hand, the therapist holding from both sides. Okay, from the thumb side and from the little finger side. So if the therapist is holding from both sides, so what is the movement that therapist is going to perform? Okay, so just by holding, his fingers are grasping the palm of the patient, and basically the thumb is on the posterior side of the or dorsal side of the patient's hand, and basically they are just stretch, or you can just say that putting force in the direction opposite to each other in this way. One hand is moving in this direction and therapist's other hand is moving in this direction and performing the cupping of the hand. Okay, the cup shape, you can just make a patient's hand in a cup shape movement. Okay, this is why this is called cupping. And flattening, when you can release this and stretch this backwards and relaxes the patient arm and slightly improve this, or you can just say that slightly increase the range. So you can just flat the arch of the hand at the carpometacarpal and intermetacarpal joint. Okay, we can just see. Place the patient's hand, place the fingers of both of your hands in the palm of the patient's hand as we have discussed, and your thenar eminence on the posterior aspects. Okay, your thumb or thenar eminence on the posterior aspects. Don't the metacarpals palmar word, that means on the front side. Okay, as I have told you, to increase the arch, and dorsal words to flatten the arch. Okay, if you can basically move on the anterior side or the palmar side, you can increase the arch. And if you can move your hands as a therapist, your hands putting force on patient's hand, and on the dorsal side, that is basically flattening of the hand. You should not have to stretch the arm. Okay, you should not have to stretch the patient's hand. You just have to basically cupping or flattening the arch on the two joints, that is metacarpal and intermetacarpal. Alternate movement is one hand is placed on the posterior aspect of the patient hand with the fingers and thumbs cupping the metacarpals. There are many alternative methods as you can just easily perform this movement. You can just place your hands as according to the patient's needs, requirements. Notifications are always present in the physiotherapy as we have discussed before. So, extension and abduction of the thumb at the metacarpal joint are important for maintaining the web space. Okay, very important for the functional movement of hand. Isolated flexion, extension, abduction, adduction range of motion of this joint should be performed by moving the metacarpal while stabilizing the trapezium, as in mobilization as well. Now you can just mobilize, you cannot just completely move the metacarpals, but you can just some kind of movements after skewering the carpal bones. That is that they have told you one of the most important trapezium. But this is the methods that are going to come. But this is very important in including your prescription for the patients whom you want to improve with their hands range of motion. Okay, this is very important in the functional movements of hand, in the grasping, in the holding of any object. So thanks for watching. If you have any query, then ask. And this is all for today. Bye bye.